Good evening, dear friends. Well, it's finally time to completely eradicate scoliosis in the territory of the Russian Federation. For this, we have gathered with you today at the screens of our YouTube receivers, not just for nothing. Happy birthday to everyone who has it today, and by the way, bon appetit to everyone who is eating. I also heartily congratulate you, friends. Today, the 13th of October, we celebrate World Egg Day. So, friends, first of all, diagnosis. We need to understand who we are, where we are, how to treat, what to treat. Scoliosis, it does not sleep, and we should be ready to thwart its cunning plans at any moment. So, diagnosis. We approach the mirror and look at the shoulders. Which one is higher and which one is lower? If you can't determine this in the mirror, take a picture of yourself. Stand relaxed, step back, set your phone somewhere, or ask someone to take a picture of you. Make sure that at least someone in your family doesn't have trembling hands. Then look at which shoulder is higher and which is lower. Or possibly they are perfectly even because you subscribed to Anton Alekseev's channel, liked and subscribed. And every like, as you know, makes one Anton Alekseev happier in the world. A person's life depends on your single like, friends. Don't skimp on likes. So, look at your shoulders. Which one is higher and which one is lower? That was step one. Next, we determine the volume of movement. We determine the volume of movement with you, which must be assessed in a sitting position, because standing, when you turn, it may seem that everything is in order. Everything turns the same way. But as soon as you sit down, fix your position and try to turn, it turns out that the angles of rotation in both directions are different. Pay attention. The head should remain in the center so that you can control the movement. You can also capture the turn in a photo or video. Turn first to one side, then to the other. You may find that the turns are the same. What should you pay attention to? First, turn and see which shoulder goes back. Pay attention to what angle you can turn to each side. In this way, you determine which side your quadriceps muscle is shortened on. If, for example, your right shoulder is lower, it means your right quadriceps muscle is shortened. If when turning to the right the angle is larger and to the left is smaller, this also indicates a shortening of the right quadriceps muscle. It prevents full rotation. And we will work with it accordingly. That is, we have determined which side the muscle is shortened and tense, and which side is relaxed. If the right shoulder is lower and the turn to the left is difficult, it means the right quadratus lumbar muscle is tense. There are complex cases, for example, when your right shoulder is lower, and at the same time, the turn to this side is difficult. In this case, wait for the video specially dedicated to you. That is, these are secondary violations. Other problems related to joint mobility are added to the primary scoliosis. We'll talk about this later. If you're in such a situation, turn off this video, get on with your things, and don't come back here until there's a video specifically for you. I'm telling you, the rest of you, come closer to the screen. Now we're starting to restore our ideal posture and eliminate all scoliotic humps. On your screens, dear friends, we present a young man with an S-shaped scoliosis. Look at that smile. He won't necessarily experience pain, as pain can be absent in scoliosis. One day on a forum, I saw an interesting post. One of the doctors posted a radiograph image which showed severe scoliosis. And he asked, "What do you think hurts?" There was a girl. She was about 50 years old. This is her picture. And he added, "Where does it hurt her?" Someone wrote, "Neck, head, lower back," and someone else, all at once. She wasn't hurting anywhere, after all. Can you imagine? Such scoliosis of the third, fourth degree is inherited. Of course, the angle can be reduced, but now let's talk about first and second degree scoliosis. As a rule, these are functional scoliosis. They depend on muscle tone and movement, forming due to its imbalance. For example, a very common case. Our patient has an S-shaped scoliosis. How did it develop? Until the age of 10, everything was fine. There was no scoliosis, the posture was perfect, and everyone was envious. But then the rapid growth started. He grew up, went to his grandmother in the village. There he herded goats, drank milk, was busy with various things, ate well, and his grandmother fed him pies. However, when he returned home from the village, his mother noticed that one of his shoulders was higher than the other. The mother thought, "The village has ruined the boy." No, friends, it turned out not to be about the village. It turned out that he had a different tone of the quadriceps muscles of the thigh, which are located between the 12th rib and the subcostal bone. Her curls fall right here. That's interesting too. Friends, they're going in 3 directions. That is, up and down, at an angle from the transverse processes of the lumbar vertebrae to the 12th rib, and at an angle from the transverse processes of the lumbar vertebrae to the iliac bone. Thus, this muscle turned out to be tense on one side and more relaxed on the other. With a sharp, quick jump, the tense muscle didn't have time to stretch, while the muscle on the other side stretched, a bend formed. This is the first reason, the quadriceps muscle of the thigh. But also, as you know, rotation can occur with scoliosis. The rotation, torsion, of the vertebrae as a result leads to a change in the shape of the vertebrae and ribs themselves. There are 2 reasons for this. The first is the lumbar pelvic muscle, which can also have different tones. On one side, it can be relaxed, and on the other, shortened. This is the first reason why the position of the sacrum changes. And from the side of the more relaxed muscle, the leg begins to move more freely in the sacroiliac joint. The movement adjusts to the scoliotic changes in the shape of the vertebrae and the position of the sacrum and the vertebrae itself. Can this angle be corrected? Ask me, and I'll answer. It's possible if the mobility is preserved and the shape of the vertebrae is not changed. Because sometimes with prolonged scoliosis, the vertebrae deform and take an incorrect shape. In such a case, it's impossible to fully rectify the situation. However, if the mobility and shape of the vertebrae are preserved, even in the presence of a twist, correction is possible. The square muscle of the lower back is very convenient to work out with the help of an egg-shaped massager in 2 ways. You can stand in front of a wall and place the massager to the side of the vertebrae to work out the muscle. You can also stand sideways to the wall and act on the square and lumbar muscles at the same time, affecting both of them simultaneously. Friends, watch how it's done. You can do this exercise lying down, but lying down you won't see how I do it. Imagine I put the ball here and lay on it. The ball should be between the ribs, between the 12th rib and the hip bone, iliac crest. The second option is by the wall. I stood next to it and put the massager here. So, with the help of feelings, I find a sick or tense place where I stop and wait until the muscle relaxes. This method is called ischemic compression. What is its mechanism? When the ball acts on the muscle, not only the muscle itself is compressed, but also the vessels that feed the tense area. By creating local hypoxia, that is, restricting blood flow to this area, the muscle begins to relax and lose tone. We use this method to relieve muscle spasm and tension. The muscle is such a structure that can tense up and refuse to relax. So now we're going to make it relax. That was a tense muscle. Now we can stretch it out as well. The simplest way to stretch is to lie down, however you like, without any special effort. If you need to stretch the right side, lie on your right side, then assume this position, resting on your forearm. If you lower your shoulder a little, the broadest muscle will stretch more intensely. Lift yourself up a little on your shoulder to feel the stretch between your hip and ribs. Just lie in this position. You might not even feel the stretch. This is because when a muscle is shortened, it can be difficult to feel it stretch. Here you can slightly shift your weight forward or backward, finding the position where the muscle stretches more. Slightly lift or lower yourself and find the optimal position. This is the place that will stretch. To treat a shortened muscle, stretch and massage it with a ball. But what about the opposing muscle? As you probably guessed, it needs to be trained. To do this, lie on your side, lean on your hand, and raise both legs. Lift them. Your task is to hold your legs in a static position, not letting them drop. Start with 10 seconds, then gradually increase the time to 20-30 seconds. Hold on, lay down and again lean on your hand, stretching the muscles from the opposite side. Then lie down again, lift your legs and hold for 10-20 seconds. This way, you're working the quadriceps muscle of the thigh and also simultaneously working the abdominal muscles. This is good, as usually both groups of muscles are weak. Repeat this exercise 3 to 4 times. In this way, we stretch and relax the right muscle while toning the left one. The sign of a correctly performed exercise is that both shoulders become level after it. So, friends, perform this exercise once a day and your back will no longer hurt. Well then, leave comments, hit the like button, engage in sports, and help your parents. Until we meet again, dear friends.